Hi, so I'm Kaye, I'm one of the physios with the Ralph team. So we're frequently asked, when do I use cold and when do I use heat with my animal? So we're going to have a look at that now, starting with cold. So the reason we suggest that you use cold packs is in the early stages, the acute stages post-injury, or indeed the early stages post-surgery. And sometimes we recommend that you use a cold pack after an intense period of exercise. The purpose of using a cold pack is that it causes vasoconstriction. So this helps to reduce blood flow to the target area, to the target tissues. It also helps to reduce the flow of inflammatory cells to that area. It helps to reduce swelling or edema, as you may see it written. And it helps to ultimately reduce the transmission of pain. There are several ways in which you can apply cold, neither necessarily worse or any better than the other. One way is your good old bag of frozen peas. Another way is putting crushed ice into a plastic bag, such as this. And with both of those methods, wrapping those in a damp tea towel. And the reason for a damp tea towel is that it helps to enhance the conduction of the cold, so a better application. Another way of applying cold is by getting a pack such as this. This is actually, it can be a hot and a cold pack. I tend to just use this one and leave it in the freezer. And most of them come with a little case such as this that you can again dampen, so it helps with the application. When applying cold, it's really important to carry out some checks and closely monitor your pet. In the human world, we recommend that people look at their skin. So a normal response is that we'd expect the skin to start looking pink ready, but an abnormal response is when the skin starts to go very white or there's blanching, and that's an indication that there is some damage to the tissues, and therefore the application of cold needs to be removed straight away. Clearly with our furry friends this is difficult because of the pigmentation of their skin and indeed their fur. So really it's important that you're looking at their behaviour and watching very closely. Are they trying to get away from the stimulus? Are they licking their lips? Are they trying to scratch you, nip at you? So you know your pet best. So have a little look out for those things, and if you'll see them, take away that cold application straight away, or indeed add an additional layer of a damp tea towel around that compress. With regards to how long you treat them for, in the human world, I often recommend that people use their ice for 10 to 20 minutes, but again within the veterinary world we have to be cautious, so quite often I minimise it to 5-10 minutes, again making those close observations of your pet. And generally we want you to apply this application every 2 to 4 hours for the first 48 to 72 hours. But it's really important that you work closely with your physio and indeed your vet, and they will guide you as to how long to apply this treatment and at what interval. Okay, hope that helps, and now we're going to move on to heat.